Welcome to our Ask an Expert show, where I invite a fellow professional to come in and talk to me about the issues we think Brits in America need to be aware of if they are going to thrive here. My guest today is Misty Kimbrough. Misty is an insurance broker and she is the CEO of Red Apple Insurance. Red Apple provide a wide array of insurance from health to dental, vision, long-term care, travel, and what we are here to talk about today, senior benefits, i.e. Medicare planning. That is Medicare Supplement, Medicare Advantage, and prescription options. Misty is an expert in Medicare and early retirement insurance. When it comes to Medicare, she specializes in guiding people through Medicare basics and avoiding common planning mistakes. This is such an misunderstood and a vitally important topic. I'm sure it is to Americans also, but to us Brits, who are just not used to having to think about these things, navigating the US health insurance system in general and Medicare in particular is bewildering and overwhelming. But it's obviously of such vital importance to our health and well-being, physical and financial, that we need to better understand it to make good decisions about healthcare coverage in retirement. So that's what we're going to do today. We're going to demystify Medicare and the seemingly dizzying array of options. So without further ado, let's get into this. Hi, Misty. Welcome to We're the Brits in America podcast.
Hi, thank you for having me today. I'm excited to be here.
Of course. No, thank you. It's it's such an important topic. And as I alluded to, it's one that just, I remember when I first got here and trying to navigate health insurance and then later advising clients and trying to navigate this stuff. It blew my mind. I also find it's one of these things that I can't hold on to. Right, I've written blogs about Medicare. I've written about Part A, Part B. I've done videos about them, and it's one of these things I can't hold on to the information. I have to always go back and revisit it, and it's bewildering. It is overwhelming. It is bewildering, and I think people just don't understand it, and that's got serious repercussions. So I'm really hoping we can get into it today and shine a light on what people need, the importance of people need to know and how they can navigate it.
Yes, absolutely. So if we want to start about Medicare right off the bat, I just want to say that I'm an insurance broker, so I do offer Medicare and ACA products. So I'm actually not I'm an insurance agency or broker. So I offer many different products in the marketplace.
Well, I tell you what, Misty, why don't you give us I introduce you. Why don't you tell us who you are? Tell you straight from the horse's mouth. Tell us, how you ended up in this unfortunate position, sat here talking to me.
Yes. So, I've been in insurance since 2007. I specialize in Medicare and ACA products. And I represent, I can't even tell you how many companies, probably over 120 companies in all my spaces. So there are a lot of options, so it does make it really confusing out there for the consumer. And that's why I'm here to help, hopefully dispel the myth of everything going on these days, because it changes every year. But, the rules change every year, and so do the pricing. There's some big changes coming for 2025, which are going to be really nice. So I'm excited to talk about that too.
Is that the prescription stuff?
Yes.
Okay, great. Well, we'll save that. We'll save that nugget for later on then. So let's start at the beginning then. Medicare. Tell us what we need to know about Medicare.
So your Medicare Part A and Part B is for anyone original Medicare. So it's for those over age 65. Or with a disability or end-stage renal disease. Part A you can get if you work 40 or more quarters in your lifetime, and there'll be no cost to that. Otherwise, you will pay a cost for Part A. Part B has a cost to it, and that changes every year. For instance, this year it's $174.70. And we have some options to go with. So if you have just original Medicare, you need to supplement that with something. You're allowed to apply for Medicare Part A and B 3 months prior to your 65, the month of, and then up to 3 months after so you don't get a penalty, right?
So you can actually get Part A even if you don't have 40 quarters. You just have to pay for it.
Yes.
And is it astronomically expensive or is it reasonable?
Right now, it's starting out at $278 per month.
I didn't know that. I just thought if you didn't have 40 quarters, forget about it.
Yeah.
But it is still an option.
Yes.
I'm jumping around a little bit, but does that mean occasionally I'll get asked by someone who wants to bring the parents over? So the parents obviously don't have anything like 40 quarters. Does is Medicare still an option for aging parents who don't have any background in Social Security?
Yes, they can still pay for it as long as they're a citizen. Yeah.
Oh, as long as they're a citizen.
I mean,
You couldn't if they were.
yeah, I mean, they need to have lived here because you can't get it just by coming into the United States, right? Like just
Really?
living here.
Even if you pay for it.
No.
Right. Okay. Right. So tell us what are Part A and Part B?
So Part A is hospitalization, and Part B is doctor visits, laboratory services, excess fees, blood work for Part B. So Part A, hospitalization, skilled nursing, things like that. And then you have Part C, which encompasses Part A and Part B from a private insurance carrier. And then you have Part D or a Medicare supplement, which we'll get into more later on. But Part A, basically, I think the easiest thing to remember is it's hospitalization, and Part B is doctor visits.
So Part A is if I'm in a bad accident. Part A is what happened to me recently. I ruptured my Achilles and I had to go to the hospital.
Yes.
So that would be Part A, right?
Yes.
And then Part B is my regular doctor. So I had surgery and it was scheduled afterwards, and I've had follow-up visits. Would that be Part B or would that be Part A?
Follow-up visits would be Part B.
Oh, okay.
Yeah.
Right. So if I've got 40 quarters, no fee for Part A, but there's out of pocket and deductibles and all that fun stuff.
Yes. So Part A has a deductible that changes every year. I'll just throw out it's about $1,400, but that goes every 60 days. So like if you were hospitalized for 10 days and then you go back into the hospital in 61 days, you're going to pay that Part A deductible again. And then you also pay 20% coinsurance. So that's the one myth about what people don't understand about Medicare is that there is no out-of-pocket limit if you only have original Medicare.
Wait, so I've got original Medicare. I have a heart issue. I go into hospital. Mm-hmm. I have $100,000 worth of surgery, whatever it is. I'm on the hook for 20% of that?
Yes.
Without a cap?
Yes.
Yikes.
Yes.
Okay. Ow.
Yes.
Right. And what about Part B then? There's a fee. There's a monthly fee. What about out of pocket and
so on Part B,
deductible?
The standard premium changes every year, but so for this year it's $174.70. Mm-hmm. Then you could get an income related adjustment.
A month.
Per month.
174 a month. Yeah.
Which is really inexpensive for what the cost of under 65 insurance is. So on your Part B, you can get an income-related adjustment depending on your income, and it's a tier, and it starts that if you make more than $103,000 per year, that's for this year, per individual, or $206 for a family, husband and wife filing jointly. So you could get all the way up to $500-600 per month range for Part B.
$500-600 a month range.
Yeah.
Wow. And am I right in thinking it's on, they look at the income level from 2 years ago?
Yes, that's correct.
So if you're an early retiree, your income level, if you're 65, right, or 66, and your income level from 2 years ago can be substantial. Mm-hmm. So you're saying can you appeal to them and say, look, that was my income from 2 years ago, but I don't have that now, I'm just retired?
Sure, of course.
But what about if you are still working? Because people go on Medicare when they're still working, right?
Sometimes. It depends. I mean, you're entitled to Part A, and if you've been working, so there's a few things you've got to think about. That's why it's really important to have an agent to talk to. So, for instance, let's say that you're still working and you're set up on a health savings account plan with your company, and you go ahead and apply for Part A, well, then you're not eligible to contribute to your HSA any longer. So that's one of those things that most people don't know. So it's something you have to be really careful about. But normally, most people will take Part A a lot of times. And then depending on the size of the company, if they have 20 or more employees, then the insurance plan through the company would be primary, the group coverage, and Medicare would be secondary.
Okay, got it. Right. Okay, so just back to that diversion. Back to Part B. So the monthly contribution can be substantial. Hopefully, you can get it down though. What about out of pocket and co-pays? Is that a big deal for Part B?
Yes, sure. Because if you have Part B, you're going to have your Part B deductible, which changes every year. It's very low. Oh my God, what is it this year? What is my deductible this year? I think it's $164 this year. It changes It changes every year. Well, 1 year it didn't, 2 years ago. And then you're going to pay 20% co-insurance on top of that.
Again, 20% co-insurance. And so obviously Part A, going into hospital, having surgery, having these big issues, that can ratchet up quickly. Part B, can that explode as well? Can that get does that have the opportunity to like balloon into massive payments?
Sure. I mean, I wouldn't say probably massive payments. So I shouldn't say that. So Part B also covers your prescription drugs that are administered in the hospital or administered. So let's say you had cancer and you decided to go on chemo, you would pay 20% of those costs and there'd be no out-of-pocket limit. And that would fall under Part B.
Wow. Crikey. All right. So 20% without limit on Part A, 20% without limit on Part B. You touched on prescription stuff. Where does prescription stuff come into? Because that's separate again, right? If you're on a cocktail of drugs, that's under neither Part A nor Part B.
Sure. Right. So you need a separate prescription drug plan. That premium, I'm not even going to throw out a premium because it changes every year, but it can be as low as, let's say, in Texas, for instance, as low as 50 cents per month. But you do have possibly a deductible, co-insurance, co-pays, depending on what tier the drugs are. And there is what we call an out-of-pocket limit for that, which is catastrophic coverage, which is all changing next year. So I don't want to go into real big detail about it, but next year it is changing quite a bit. So the maximum out-of-pocket that you're going to pay for drugs next year in 2025 will be $2,000.
Okay, yeah, that's the good news that's coming. But so is that, does the prescription plan cover any and all drugs, or if you need a certain drug and it's not covered, are you just in trouble basically?
No, so every drug company creates their own formularies, right? So, but they have to have at least one drug from every therapeutic.
Okay.
Yeah, so something's covered some way, somehow. So basically what you do is you really shop around for your Part D plans every single year. But let's say that you did, like, in May, you got on a drug that you weren't on in January. You can ask for a formulary exception, and they have to grant that formulary exception if the doctor provides all the documentation. So basically, your doctor would send in a form that's online, and then they'll usually accept it. If it's something that the doctor says, no, they have to have this brand, nothing else works for them.
Okay. So it's not a case of like the nightmare scenario of I'm on a life-saving drug, right? And that is covered by Medicare this year. Next year, for some reason, it's no longer covered, and I can't get at it. I'll still be able to get at it or an equivalent.
Yes, yeah. There'll be something. Yes.
Okay, good. All right, that's some good news.
Yes, and then like I said, or you can ask for a formulary exception.
Okay.
And they have to refill it. So, like, let's say you change drugs or you were on group coverage, and then when you first start Part D, you pick a plan that it's not covered under. For some reason, they have to refill it at least one time within 90 days until you get it figured out.
Okay, got it.
Yeah.
So I think there's a misconception, maybe amongst us Brits, but again, because we grew up where our health needs were mostly provided for. There's a lot of problems with the NHS, but we knew it was there, and there were going to be no costs for us, essentially, free at the point of service. And I think there's a misunderstanding of Medicare that when we get here, it's going to be the equivalent of the NHS, and it's not. And then I think there's the feeling that, okay, so there might be some monthly premiums or co-pays, But like my private insurance, there'll be a reasonable out of pocket. But to hear you say it's 20% without limit in what is going to be the most likely to be the most financially draining, medically financially draining years of your life potentially. I think I've heard a stat. Don't people spend more in health care costs in their final year of life than the rest of their life combined? I don't know if that's.
Oh, absolutely.
I'm pulling that from somewhere. I don't. Yeah.
Absolutely.
So you can be on Medicare, but it can still financially ruin you if this goes wrong.
Well, no, I mean, there are things that you can do to prevent that, right? So, one of the options is to keep original Medicare and pick up a Medicare supplement with a prescription drug plan. That would limit your out of pocket costs. And then there's also the option to go with a Medicare Advantage plan. So, you do have that option, or stay on your group plan so that you have that co-insurance coverage. Yes.
Do you find people? We're going to talk about this in a second. Obviously, this is essentially what we're here to talk about. But do you find people come to you and they haven't got any coverage? They are just on Medicare Original, and they've got this. They're not aware of this like massive risk. They've not been made aware of it.
No, I mean, I think that you get really bombarded about a year before you turn 65. That if you're not aware of it, then I'm really in shock. I mean, there has been some times where maybe someone came off group coverage and they didn't realize that they needed to get it within a certain amount of time to avoid a penalty. And then every once in a while, I'll have somebody that just has original Medicare, and I'm like, you've lost your mind. You have to do something, right? Like that's not good. So, yeah, and there's a lot of different little nuances about deadlines and things like that you really have to pay attention to. I mean, sometimes I have to go back and review them myself just because there's so many different things. So it's really important to have somebody that'll be on your side while you're navigating this. I mean, I have clients call all the time and they're just like, I don't know how you do this. Like, this is complicated. So that's why I'm here.
It is complicated.
Yes.
It is complicated. Right. Let's talk about the options, the solutions. How do we make sure we're not on the hook for 20% without limit?
Well, your first option would be to choose a Medicare Advantage plan, which basically encompasses Part A and Part D, Part A and Part B, and in most cases, Part D. There's some plans, and I won't get into all the details about that because it's extremely detailed, but there are some plans that possibly wouldn't come with Part D that you may be eligible for, but there's certain situations where if you pick just a Medicare Advantage plan, without that, you cannot add a separate prescription drug plan on. So more than likely, if you're going to go with just a Medicare Advantage plan, it's going to be because maybe you're a vet and you have other coverage through something else, or maybe your company only offers Part D because they have a standalone, plan through their company or something like that. So your Advantage plans will encompass all your coverage in one, right? And then it's going to have an out-of-pocket limit for you. And those range. I'm not even going to say the ranges because it just depends on the company and what state you're in. But there are maximum limits set every single year. And usually, I don't know yet what it's going to be for next year, what that maximum is going to be for next year. So you're usually safe at the max around $8,000 for this year. So it just depends. But it can be really low. It can be as low as $2,800 that you would be out of pocket. And so people ask, well, how do I get to that $2,800? So typically, and not always, there's no deductible on these. There might be a prescription drug deductible, but you're going to have co-pays, say for your doctor visits, hospitalization. Usually on a Medicare Advantage plan, your hospitalization is capped at a certain amount of days that you're covered. And so it limits that exposure. What was that?
What happens if you go over without a Medicare Advantage plan?
What was that?
What happens if you go over the number of days and you don't have a supplemental plan?
On a Medicare Advantage plan?
No. So if you're not on Medicare Advantage, if you're just on regular Medicare, and you go over, you have a catastrophic accident or you're in a coma or something, you go over the number of days that you're covered. Are you on the hook for everything else?
Yeah, I mean, with Medicare, you do have a lifetime maximums of hospitalization over your lifetime. But like if you only have original Medicare, you're pretty much gonna be on the hook for it. But the good part about it is you can always opt into a Medicare Advantage plan, right? Every year. So if you have original Medicare during your AEP or annual enrollment period, you can sign up for that. So like if you miss the cutoff or something like that, then and you only have original Medicare, you still won't face the penalty, but you can change to something that does give you that out-of-pocket limit. And that's the same. The other option would be to go with a Medicare supplement.
Well, just so, oh wait, Medicare supplement, which is Medigap. When I hear people talk
Medicare
Medigap,
supplement.
Medicare, is this the one that like fits in around? So you keep Medicare, but you add in a Medigap policy or a Medicare supplement policy, right?
Right.
Okay.
So, and there's standardized plans. So it basically, there's no, if you were 65 after if you turn 65 after 2020, for instance, your Part B deductible will not be covered. Okay. But then you can pick plans that would cover everything else, right? So the only out-of-pocket you would be is that Part B deductible, which is very low. So those co-insurances, your Part A deductible would be covered, and then you would pick up a Part D plan on top of that. Okay. So for instance, right now, the most comprehensive plan you can get if you turned age 65 or turning age 65 after 2020 is Plan G, and that's the most comprehensive plan there is.
Okay.
Yes.
Whereas Medicare Advantage is like a whole separate policy.
Yes. So you cannot have a Medicare supplement and a Medicare Advantage plan.
Okay.
You cannot have both.
So you either have Medicare, you have regular Medicare, and you overlay it with a Medicare supplement policy.
Right. So original Medicare with a Medicare supplement. Yes.
Right. Or you have a Medicare Advantage policy.
Right.
And you don't really deal with Medicare in that case, is that right? Medicare you deal with everything. You deal with your policy like I would do my regular health insurance provider.
Sure. So if you have a Medicare Advantage plan, then you'll have a card just like you do with your under 65 plan, say from a certain company. It doesn't mean that you don't have to pay your Part B premium, right? Because you still have to pay that. And technically you still have Part A and Part B because you can't have Part A and Part B and still get a Medicare Advantage plan, right? So, So you'd have to have one or the other.
Okay. And which in your practice, which is more common? Does it depend on the person you're dealing with? Is it some people it's clearly Medicare supplement? Is it some people clearly Medicare Advantage? What fits who?
I wouldn't say that I could really comment on that because it really depends on the individual and on their individual circumstances. I will say that a Medicare supplement originally was made for people that had illnesses, right? Because they'd have a very low out-of-pocket. And now Medicare Advantage plans, they have a lot of times dental, vision, hearing in with that, which you don't get with original Medicare. So some people like that benefit, but then you do have some restrictions. So let's say that you have original Medicare and you have a Medicare supplement. As long as your doctor takes original Medicare, then they'll take any Medicare supplement. And then that network is original Medicare. So there's no place that you can go look up magically. If a doctor's a network, you physically have to call them and say, do you take original Medicare? So that's one of the things that I find limiting with maybe a Medicare Advantage plan, which I probably shouldn't say that, but there's a network that you're normally used to, just like with under 65 if you had health insurance. But I call myself a network snob because, being from Texas, in my hometown that's very specific about networks. Like my clients like a specific network. So like I really check those out. So I think that's one of the things that with the Medicare Advantage plan. I mean, I think since I've been doing this, I think, and this only happened once about 10 years ago, and then in the last 2 years, 5 doctors that I've ever had that did not take original Medicare. And literally 4 of those just popped up last year or in the last 2 years. You know, that my client said, oh my God, my doctor didn't take original Medicare. So that's been kind of shocking. Where on a Medicare Advantage plan, you have to check the network. I check the network of providers. It can change throughout the year. They don't have to accept it the whole year. And then you might be restricted to where you can go and who you can see. So that's one of the things that I think is really defining between the Medicare supplement, original Medicare, and a Medicare Advantage plan. And then also the cost, right? The monthly cost. You know, a Medicare supplement has a higher premium, and a Medicare Advantage plan has a 0 to low premium.
Really? Why?
Why? Well, I mean, one is because you're sharing some of your cost, right? So on a Medicare Advantage plan, you've got not a deductible maybe, but you have an out-of-pocket maximum that you have to pay every year. Where a lot of Medicare supplements, they're basically paying for everything except your Part B premium if you pick Plan G, right? It also depends on how they're subsidized by the government, right? So.
Right. I get the whole network thing. I was treated by Yale New Haven here, and the care was incredible. And it makes you get used to it. You get used to the people. You get used to the facilities, retaining access to that, especially as you get older, is important. That's really interesting. So, I thought it was the other way around. Medicare supplement is more expensive than Medicare Advantage.
Yeah.
In general.
Yes.
Right.
And a Medicare supplement is going to change depending on what plan you pick or what company you choose, because they're either they may change because of your age, depending on how that company rates them. So every year you could have a premium increase, or if it's community rated, the whole community would get a rate increase. It wouldn't matter about your age. So those are a few other factors to consider when you're picking a company to be your Medicare supplement.
Do people try and do this on their own?
They do.
Wow.
I mean, I have to say that the Medicare.gov website is very resourceful. I do. I mean, I have to say that. I mean, it's a lot of information, right? But I have to say it's very good. It's very good.
And do you find, do people swap and change every year? Or do people tend to find something that works for them and stick to it?
Well, I mean, I think, so on a Medicare Advantage plan, a lot of people change every year. One, they get a lot of stuff in the mail, right? Companies may change what territory they're operating in. Their out-of-pocket maximum may go up too high, or they decide they want a PPO instead of an HMO. Another company could come into their service area. And then also, like, even with a Medicare Advantage plan, I always say your prescription drug plan is more than likely attached to your Medicare Advantage plan. So those formularies could change every year, right? So you really need to shop that as well and make sure that your medications are covered for the following year. If not, you need to plan for a formulary exception, or you need to plan for something to make sure that you're covered when that change does take place. With a Medicare, let's see. What was the question again?
No, with Medicare, do people swap and change?
Oh, yes. Yeah. So with a Medicare Advantage plan, you can do that. No, there's no medical underwriting. You can just change whenever you want to, right? A Medicare supplement, you can change any time of the year. There isn't a certain open enrollment period or an annual enrollment period for, I mean, I shouldn't say that exclusively, because there kind of is an open enrollment period for Medicare supplements as well. Basically, during your first year of aging into Medicare, then you can get a Medicare supplement without underwriting for the first 6 months, right? After that, you'll have to go through underwriting unless you have a qualifying event. Like, let's say that your company decided they weren't going to operate in Alabama anymore, right? Then you could switch companies without underwriting. So there's certain rules that you could switch. And it also depends on the insurance department in that state as well. So those are little things that you kind of have to, because basically, like if you're sick, okay, and your premiums went up to $500 because you have a Medicare supplement, and then you find out you have cancer, let's say, you can't switch to another Medicare supplement, right? Because you won't qualify if you're outside of that time period.
Wait, so there is medical underwriting for Medicare supplements. So will they deny you? Can they make it prohibitively expensive? Can they exclude pre-existing conditions?
No. As long as you had prior coverage, no pre-existing condition exclusions, no.
But can they make it prohibitively expensive?
No, I mean, you're not rated on your health condition. So let's say you turn 65, you're going to get a Medicare supplements guaranteed issue. It's your open enrollment period, so you've got it. There's other times, like I said, you have the guaranteed issue periods. So let's say you're coming off, you're 70 and you decide to retire. You sign up for Medicare Part B then you can sign up for a Medicare supplement without underwriting. So there's certain times when you can. Mm-hmm.
But if I miss that window?
No, you'd have to go through underwriting.
Right, wow, okay. And then what the repercussions of going through underwriting? Potentially.
What kind of questions?
Well, no. What are the repercussions? So I missed that window for whatever reason. Later on, I want to get a Medicare supplement plan. I go through medical underwriting. They're not gonna exclude me for pre-existing conditions. But what are they? Could I just get astronomical premiums?
So there are some that offer standard rates and then like premier rates due to certain health conditions. But otherwise, typically you would just be declined.
Really?
Right. Yeah.
And then what are my options then? Medicare Advantage.
Yes.
And there's no underwriting with that, but it's less flexible, it's less attractive. Well, look, obviously it's horses for courses, and there's pros and cons to each. But in general, what I'm picking from this is, given the choice, if I have the financial resources and I make sure I don't miss deadlines and stuff, I'm leaning towards Medicare supplement. It sounds like.
I would say probably so. But the Medicare Advantage plan just keeps getting richer and richer. You know what I mean? Like, as far as the perks, because now they're giving one of the biggest things I think that people ask about is most Medicare supplements, well, not any that I offer, offer like fitness for free, right? Which is a big perk for a Medicare Advantage plan because they get to go work out and there's no charge, right? Then there's some other things. Like I said, they might have dental, vision, hearing also inside of that. Now they're even giving money every year to go play golf, that you can get reimbursed for, or buy a yoga mat. Wow. So there's those plans out there that, may pay, I don't want to throw a number out there, but, may pay up to, let's say, $600 for you to go play golf. Just trying to keep you healthy and fit, right?
Wow. Yeah. I wasn't expecting that.
Yes. So that's kind of like when you start weighing that out, a lot of people say, well, I'm going to have that out-of-pocket maximum. Okay. I don't plan on getting sick, right? And they want to take that because they have a low premium, right? A really low premium, or no premium. So, yeah, it can make a big difference.
Do people really say that? I don't plan on getting sick.
Oh, yes.
It's a dangerous game to play.
Oh, yes. Yes. Wow. Yeah. And I always tell a story about one of my friends that ended up with 15 blood clots, healthy, worked out all the time, and ended up, almost 2 years sick. And he had insurance, but they're like, never expected this to happen, right? Oh. You know what I mean? Yeah. You just tore your Achilles, right? So I'm sure you weren't expecting that to happen. Yeah.
I absolutely wasn't expecting to happen. Although, like I said to you before, I should have known. I did the other one a decade ago, so I have the dubious honour of having 2 ruptured Achilles. So, yes, better to be prepared, folks. I had no intention of this happening to me. Well, should we talk about the prescription side of things then? You alluded to before there's some changes coming, and
Sure. So on the prescription drug plan, which is a standalone prescription drug plan we'll talk about now, that's something that you would pair with a Medicare supplement, and in some cases possibly a Medicare Advantage plan. And that's like really in detail, so I won't go that route right now. But so your Part D plan for 2025 is actually going to be capped at $2,000, which is amazing because prescriptions are the biggest expense for seniors, right? So it's going to really help. Like I mean, I have some clients, you know, with the out of pocket catastrophic at $8,000. You know, that's a lot of money every year. You know, so cutting that, and then also they're bringing in for 2025 a payment plan. So basically what that means is you can pay for your prescriptions throughout the year. So right now, so what happens sometimes is they have, like, for this year, they might have a $545 prescription drug deductible, and they take really expensive drugs. So the first month they're hit with $545, right? That's a lot for somebody that lives on a limited income. So now you're going to be able to space that out throughout the year instead of getting hit all at one time. So that's going to be a nice benefit.
Good.
Yeah.
Oh, great.
Yeah.
These are really positive benefits.
Yeah. I mean, yeah, I think so. And there's other things. You know, you can get also an income related adjustment for Part D. That's going to stay about the same. So you could pay up to, for instance, what is it this year? I think up to $70 additional dollars. No, 81 additional dollars per month for the income related adjustment. So that would be on top of your Part D premium. So that's something that you have to consider. So if you start adding it up and you've got a Part B income related adjustment, you got your base premium, you got your Part D, then you've got, you know, it can add up. I mean, some people are like, well, should I, you know, leave my group plan? You know, because now I'm already up to $700 or $800. But the good part about it is, depending on what you have, you're probably going to be out of pocket a lot lower with Medicare.
Okay, good. Whew. There's a lot going on, isn't there?
Yes. Yeah.
There is a lot going on.
Yeah.
I'm still reading for 20% no cap. The idea of someone out there without some additional coverage is it's terrifying.
It hasn't happened a lot in my career, but it has happened. It has. And then if you don't sign up, there's certain rules, like when you can actually get, it might not start till July the following year. So if you don't have Part B, or someone might forget to sign up for Part B, and then they just have Part A.
And what happens in the interim? If you go to the doctor, you're on the hook for it.
Oh, yeah, just like having no coverage. So if they don't want to pay that premium, but then I'm like, well, you're going to pay a late penalty too, right? If you sign up late for Part B.
Well, you've mentioned that a few times, Misty. What kind of penalties are we talking?
It depends. It's 10 basically for Part B. Hold on. It's a 10% penalty for Part B, and that never goes away. Yeah.
10% penalty of the annual premium.
Yes. For every year.
All right. Every year
that you don't enroll.
Okay.
And then it's prorated. Okay. And then, like for prescription drug deductible, it's 1%. Of whatever the standard rate is. So like for this year, the average premium for prescription drug is $34.90. So they would be responsible for that portion of that for however many months, 1% of that cost, and it'll change. So next year, let's say the average cost for a prescription drug plan is $50, and they're going to pay 1% of that, and for every month that they weren't enrolled in a Part D plan. And a lot of people are like, well, I don't take any prescriptions. And I'm like, I know, but like, you might be able to get a plan for 50 cents a month or $10 a month. you start stacking that Part D penalty on there and it stays for the rest of your life, you're going to wish you had. Because a lot of people now feel like they have other options on how to get drug coverage, or, they're not doing medications anymore. They're doing supplements and alternative medicine. So, yeah.
Whew. Before we move on, anything else to say on Medicare planning, Medicare supplements? other than seek help. Don't do this yourself.
Yeah.
That's coming from me.
I think, let me think. Well, I think it's really important to remember that you need to enroll in Part A and Part B 3 months prior to your birthday month, a month before your the month of your birthday month, up to 3 months after, or you will face that penalty, right? So that's your initial enrollment period. And then we also have AEP, which is the time that you need to shop, right? So you need to shop your prescription drug plans. So for instance, like for me, like I send an email to my clients as soon as I can start marketing Medicare, which is October 1st. And I just say, hey, we have to review your medications, and they're used to it. Like I know that a lot of agents don't do that because it's very time consuming, but it's getting better so that we can see if they need to change prescription drug plans for the year. And I'll also, want to review their Medicare supplement. And most people, I say, for your Medicare supplement, like you can stay where you're at, right? We can deal with that any time of the year. It doesn't have to be during annual enrollment period. And then we also have an open enrollment period now, which starts January 1st to March 31st. And that's when you can play around with your Medicare Advantage plan if you missed it during the AEP. So very specific wording, AEP, OEP. But you won't see anything on OEP because agents can't market it. So it's like you really have to call me and say, I don't like this plan, I tried it, or I can't find my doctors during that time period.
Okay, right.
Yeah.
Right, Misty, that's fantastic. Thank you. Just before we wrap up here, though, what happens a lot? So again, this is for Brits coming from America. Because we don't think about this. A lot of times our clients will want to retire early, before 65, and they haven't really thought about the impact of not having access to Medicare and no longer being on group medical insurance. So can we just touch on that? So early retirement, pre-Medicare, what are people's options?
So people's options are the ACA, or what is most people call it, Obamacare. That's going to be the only way technically you can get it without pre-existing conditions excluded. Or let's say that one of your clients has a consulting company and they have one employee, or maybe their husband and wife decided to make a company and are working together, then they could get, group insurance. There's a lot of misconception out there, which is very frustrating for me because we do have short-term insurance, which Biden's administration just changed, which will go into effect on September 1st. So and this is going to go back and forth. So depending on what happens with the election this year, short-term insurance may be available for longer or may not. So this has gone back through both administrations, back and forth, back and forth, back and forth. So short-term insurance.
When you say short-term, okay. Sorry.
So short-term insurance is going to have, medical underwriting. Maybe pre-existing conditions are excluded. Maybe they're included. It just depends on the plan. Right. And, or just an automatic decline, depending on what you have. So you have to be pretty healthy to qualify. And it's more of a limited plan. I mean, some now offer some preventative care services, but they don't offer all the essential health benefits like an ACA plan does. One of the things that I really try to tell people is, because I have quite a few clients that want to stay on short term because it has a better network.
Well, wait, when you say short term, are we talking months? So can it be years?
So right now, as of today, if you're to write a policy before August 31st, you can actually get a tri-term plan that can last up to 3 years. This is also going to be state specific, okay? But as the federal government's rules, up to 3 years. The administration just changed that, and it cannot go up to more than 3 months after September 1st. So if you go into short term, so what does that mean for your clients? Pretty scary, actually. So let's say that you decide you like the premiums better, it has a better network, and you want to go on a short-term plan. And let's say you do that in March, okay? And you can only keep it for 3 months. Short-term is not considered a qualifying life event for you to get on an ACA plan. So let's say in the middle of this, you tear your Achilles, okay? And on April 30th, let's say, and you're still going through therapy. Your plan is only going to last for 3 months. If you took that out March 1st, it's going to end in 3 months. Well, you're still going through physical therapy for maybe a year, let's say. You're not going to be able to get another short-term plan. Why? Because you have a pre-existing condition, right? And you're also going through therapy at the moment. And the other thing is that it's in the middle of the year. It's not open enrollment for under 65, so therefore you can't go onto an ACA plan either. So you're just without insurance.
Scary.
Yeah. So
you do not want to be in that position.
No. I mean, and I do. I have a lot of clients on short-term coverage, but I mean, it's like I'm trying to read my policies right now because if not, they're going to have to change every 3 months and go through medical underwriting. When I say medical underwriting, there's questions. They're going to pull your prescription drug history, things like that, and then you could be declined.
So if you don't want to go on short-term, it's basically Cobra, if that's an option, or Cobra lasts for 18 months?
Yeah, so sometimes it will last for 36 months in certain cases.
Who decides that? Is that the company that decides that?
No, it's a law. So let's say that you're retiring and you're turning 65, then your spouse will be able to stay on it for 36 months because you aged into Medicare. Instead of 18 months.
Right. But if your spouse is 5 years younger than you, say, though, so she won't be required. So she might get 3 years, or he or she might get 3 years, but then there's still a 2-year window before they qualify for Medicare. So you still have an issue for them, right?
Right. Then we'll go onto an ACA plan, a short-term plan, and there's also Christian ministries, type plans that you can go on to. I like to tell people, like, it's really important that you look at a policy. Because, like, for instance, I'll just keep referencing your little accident here. But, a lot of short-term plans, when you start reading the fine print, let's say they don't cover tendon replacement, right? Or repair. So you don't know that because you didn't read your policy, and you have a short-term plan and it's not covered. It wasn't a pre-existing condition, but tendons aren't covered, right? So that's a big thing. Where an ACA plan, it covers all pre-existing conditions. There's no medical underwriting.
So why do people do short-term and not just ACA?
One, typically, and not always, not right now, not in the last couple of years probably, but the short-term has been less expensive. Also the network. The network is huge.
Network, yeah, okay. You did mention that, network, right? It makes sense.
Right, because I mean, like for instance, some hospitals don't take any ACA plans. So I'm not going to say them particular ones, but like let's say your children in an ACA plan, some of the children's hospitals don't take an ACA plan at all.
Oh, really?
Yes. So if your child has an accident or something and you want them to go to that specific children's hospital, the only way you're going to get that is being on a short-term plan. So that's I have a lot of clients that choose that just because of that reason. Wow.
If you're in your early 60s, this might be a completely unfair question and impossible to answer, but I'm going to ask anyway, right? You're in your early 60s, you're in reasonable health, good health for 60-year-old couple. What are you looking at are you looking at tens of thousands of dollars a year for an ACA plan? Are we looking with massive deductibles? Are we looking at, is it prohibitively expensive? Is it, what's it, is it going to ruin us? Is it an option or not?
It's getting to that point. It's crazy. I can't say because, state specifics and age and demographics, everything plays a role in. But I mean, you're probably looking at age 60 a minimum of $600, probably more than that. $800 to $1,000 per month, and then
Per couple or per
that's
person?
per person.
Per person, plus co-pays and deductibles and all that good stuff.
Yeah. And so the out-of-pocket
yikes.
maximum each year changes, right? So this year, what is it? 70. Last year was 6,700. This year it's 7,700 per person, or double that usually for the family. So you're talking about more than a mortgage payment.
7,700. 7,700. So we're looking at 1,000. I'm thinking about the numbers that we use when we do planning. $1,000 a month per person, plus another $8,000 out of pocket potentially if you.
And it's just going to keep going up. They think in the next 5 years, our out-of-pocket maximums are going to be over 20,000.
Yikes! They don't want people retiring early, do they? Keeping us in the workforce, keeping our noses to the grindstone.
Well, the good news, though, I mean, you could qualify for a subsidy to help pay for your premium.
Tell me more.
So there's a certain threshold. It used to be exactly if you were under 400% of the federal poverty level, you may qualify. But now it's based on more percentage of your income, which is like right at 8.9%, and that'll probably change for next year, that you may qualify. But there's a lot of stipulations to qualify for a subsidy as well, right? Like you have to file a joint tax return if you're married. You have to allow the government to see your tax returns while you're on there. You may have to pay back the subsidy. So if it's a kind of a thing where you don't know how much money you're going to make, right? Because you're in retirement, maybe the stock market hits and you get, more dividends or something. Then you can make more money and you might have to potentially pay that money back. So when choosing a plan, it's really important to say, if I had to pay this money back, can I afford to when you're picking the plan? So, and then there's other stipulations. So let's say that you need to go on an ACA plan. Or let me give a good example. Let's say, let me say this the right way because it's kind of complicated. But if you are offered group insurance, you can't qualify for a subsidy if it's deemed affordable. Okay. This year, the rules changed because it used to knock your whole family out, right? So it was based on just your income. Your income and your premium amount. And then this year they actually made it because it didn't make any sense. So you're saying, my company pays for all my premium, right? So it's deemed affordable, but for my family, it's $2,000 a month, and I only make $20,000 a year, right? So it's not affordable for my family because it's over 10% of my income. So then they could qualify. So that just changed this year. Hopefully it stays that way for next year, that they'll allow the family. So there's all these little nuances. The most important thing I have to say about ACA plans is there is an open enrollment period. You can't just get it any time of the year. And most people don't know that. I had a client yesterday that found out she probably has lung cancer. And she's like, I haven't had insurance since April. It was such a headache, blah, blah, blah. And I was like, well, you're out. So
what?
Yeah, so.
How can you, oh man.
Yeah.
I don't know how, it would just terrify me being without insurance
Yes.
for any amount of time. Oh man, you've thrown me. I was about to ask you something. I've just completely forgotten what it was with that. Oh damn! That's totally thrown me. I was really about to ask you something. That's terrible. How do you let yourself? How do you let that happen? Not you. How do you, as a human? As people, do we let ourselves?
Well, it's very common. If you can't afford it, you can't afford it. You know what I mean? When you start thinking, two people may make $120,000 a year, but you're looking at $2,000 a month in insurance. You're paying pretty much for the first $8,000 or $5,000. Then people are like, I can't eat. If they don't qualify for a subsidy. So.
Yeah. When is the open enrollment period for ACA?
ACA right now, I don't think there's going to be any changes, but it starts November 1st and then ends January 15th.
Okay. It's constantly changing, isn't it? As well, you think you got a hold of this thing, and it's like everything you caveat with. This is the rules now. It changed last year. I hope it won't change next year. Like it's not changing. These don't seem to be set in stone for blocks of period. It's like every year you're dealing with some. It's constantly moving playing surface.
Yes, I mean, because like I said, like even just with short term, it's been the same through this administration, and right now it's being changed at the very end, right?
Yeah.
And this is huge because a lot of people have short-term insurance, especially because if something was to happen in the middle of the year and they have it, they can't get an ACA plan, so they would be without insurance because of that rule. So, yeah, it's well, and we'll see how things change. I mean, I have to say, Medicare is a little bit more stable. The only thing that changes is really the numbers, right?
Okay. Yeah. Good. All right. Well, hopefully I'll be able to hold on to this information better. And if I can't, I'll just come and re-listen to this podcast.
Yes.
Misty, thanks for guiding us through this, these uncharted waters for us. Yeah. There's a lot, and it's important stuff. I mean, it can have clearly can have a serious impact on your health, but I alluded to at the start, your financial health as well. So thank you.
Mm-hmm. Oh, you're welcome. My pleasure. Glad I could help.
Misty, thank you. Where can people find you?
At redappleiinsurance.com, or you can call me. And I'll give you my stuff if you want, so I don't have to necessarily say it, but you can visit my website, Facebook, Instagram. I don't post very often on there, so I will be now.
You're on LinkedIn, I think, right?
Yes.
I've looked you up on LinkedIn. You're definitely on LinkedIn as well.
Yes.
So.
Yes.
Wonderful. All right. Well, thank you so much for coming on with the Brits in America.
Thank you. Thank you for having me.
Cheers.